Welcome back. Zeynep, we missed you. Welcome back. Okay. Welcome back, everyone. Now we are going to talk about health system in this session. As we mentioned in the morning, the virus has affected our lives in different departments, different sections, and we are going to discuss the health issue right now. First question is, do you think, yes, Zeynep?
Before we start, can I ask a question about resolution paper?
Sure.
Is it going to be like everyone style, like A, I? Are we going to write it like that?
Yes. No, actually, no, you're not going to write like that. I think we are going to, actually, the former session, we talk about it a little bit. I said for the last session after this, talking about health system, we are going to make another session and we are going to sum up the day, okay? At that point, we are going to talk about what the resolutions could be, like for education, for economy, and for health system. Right now, we are talking about, and the social life. And we are going to take notes about it. And those are going to be our resolutions. So our last session is going to be the time when we take down our resolutions. Okay?
Okay.
Now, how do you think the countries handle the virus during these 3 months, starting from June, starting from January till now? How do you think people handle it? Do you think we are able to control the illness and the sickness, or how the things are going on? I'm too tired. I can't make it up. Okay, we are going to discuss the health system. We are going to discuss the rights and wrongs about going on in health system. What do you observe at the moment about our country and about other countries? Do you think every health system of each country is doing their best? Are they working good? Is the taking precautions working out? Is the health problem of this virus is under control? Can we say that everything is under control? We can start from Turkey. Do you think we are doing fine? Yes, Zeynep.
I think we're trying to do our best, but we couldn't take it under the control. We can't say this, but we are trying to do our best. But our facilities are not enough, and we are living some economic crisis in our country. So it becomes so hard to take that virus in control, because this is, as I said at the beginning of the day, this is a kind of thing which is so extra, and countries are not ready for this. So I think Turkey did his best, but still we couldn't control it.
Could someone be ready for such a situation? I mean, as Zeynep said, she's completely right. We weren't ready for this kind of issue. We were not expecting such a thing to affect all the world, not just a country, but now we are all affected and we are suffering from the same devil. So could anyone be ready for such an issue? Do you think we should had a B plan? Yes, Shawai?
Actually, Bill Gates has had a prediction about a virus that can damage the world. Maybe another scientist uh, had some prediction about this, but as governments, as countries, we were totally not expecting something like this big. So I agree on Zainab. And also, in addition, I want to say about Turkey's condition. I want to say that we have more equipments. Like in hospitals, we do have beds because in some countries, the sick people can't even find a bed um, um, to get cure while they're in hospitals, and I think it's great for the Turkey.
So we can count ourselves doing well in this situation because at least our people are under good care of our health system, right?
Yeah, Turkey citizens believe the Ministry of Health and do their best for him, and take serious what they say, what he says, right? Yeah.
Okay. Anybody else? Yes, Abdurrahman. How are they
Yeah,
in your country?
the country which I live right now, I think this country is doing very best because here the confirmed cases are approximately 89,000. Out of 89,000, 65,790 are recovered.
That's good.
And yeah, and every day the recovering rate is increasing, and the confirmed cases are decreasing by the grace of Allah, and it is very good, and they are doing the best because here the people are obeying to the government, and even the government are helping. Here now in Saudi Arabia, they're providing every month, they are providing free food packages for every family, for the poor family. And the second thing, they send the messages to our mobile phones or cell phones that don't worry about any medical like don't worry about any if you don't have money for going to hospital, they will do for free.
Free, yeah.
So that's why the people are inside the home, and the people because the government keep messaging us through this mobile phone, like don't worry, don't be panic, we are with you. If you need anything, immediately inform us. So now here all the villages, all the regions here are closed. There are militaries outside. They are not allowing us to go out of our boundaries, but it is a good thing. The When we go there, they try to explain us, they try to encourage us, they motivate us. If we are in a very bad condition, then only that time they call ambulance or any other things. But everything is free right now in Saudi Arabia, and even though they are not asking the electricity bill right now, they're not asking this anything, so the people are not that much panic for this. So most of the people, the poor people, those who are staying here, are very confident and peaceful. So we are doing the best here right now. Here the recovering rate is increasing day by day.
So you find it's supportive to send messages every day and it makes you feel confident about that there are some people that those are going to take care of you if anything happens to you. So it is an issue that helps people to keep on going, not to give up at the moment.
Yes.
That's nice.
Yes.
That's
Yeah.
a good thing to do. Good. What about the lockdown issue? I mean, okay, it's a precaution. We have to stay at home as long as we don't have to go outside. Like some of us has to work, Probably many of your fathers are outside right now and they're trying to earn money to keep on going because as far as I know, in Turkey, we don't have that food support this much. I haven't heard it, but probably there are for poor people. But for that, even you have to prove that you are unable to make it and buy things to eat. So we have to work, we have to go outside. But the others should stay at home, and they keep on saying on radios and televisions and any place that they can reach us, they keep on saying that, please, if you don't have to go out, if it is not a must for you, stay at home. How do you take it? I mean, is it something that is not fair? It's like, do you feel like prisoner sometimes? How does it make you feel? Yes, Shawar.
So there are famous people saying us that we have to stay at our houses while they are sitting at their luxury houses and can get what they can get anything when they want to. But I think we have to create something that will help poor people, which will provide them what they need for living. Like, because now poor people having difficult times, maybe not, they can't get their salaries, they can't go to the works. So we have to do about it. We have to do something about it, I think.
Is it, I mean, do you feel like insulted because it's not legal as human rights? You know, you have some rights, but right now you are not allowed to go outside. Is it hurts?
Actually, I don't think, and I don't assume it as it's something against the human rights, because it's about our health. This lockdown thing is just give me the right to be healthy, but I think because there are risks out there, and I don't feel like being insulted. This is just how it should be, I think.
Okay, to protect ourselves.
Yes.
It's a need. Okay. How about the health person, health care people, doctors, nurses? What do you think about them? Do you have any health employer in your house or in your family that who is a doctor or a nurse and has to work right now?
No, I don't have any, but we appreciate their works, and also we are also we are proud of them, and if we think about if it is against the human rights to make them work at the hospitals, because they're under risk every day, and they can see their child sometimes, and which is something so bad for a parent, I think.
Should it be optional? What do you think? I mean, do you think they should ask someone if he or she wants to work or not? Should it be optional not to work at this bad situation?
Yeah, maybe, but most of them do it because they want it. But if it's being optional, maybe for women who wants to take care of their child, it can be really good for them.
They would prefer not to work, maybe.
Maybe, yes.
Okay.
Because in this situation, it's not normal, and at some points we can push someone to do something.
It's normal to want to be selfish at this point.
Yes, maybe, because it's about our lives.
So they're
everyone wants to be
sacrificing
healthy.
themselves and their families for other people. It's really an important issue. Yes, Zeynep.
In this point, I don't agree with her, with Shevard, because I don't think that it should be optional, because now people are dying, and this is the thing that doctors can do. Just they can do. We can't do anything for them, so they have to do what they have. I mean, this is the time that they can do something. So
Exactly.
I think it shouldn't be optional, because they have to work, because there's a lot of people who is just trying to uh, who is just dying. So we, even now, we don't have enough doctor in the world. So if we will make it optional, then we're going to have so hard times. But I think, uh, for example, about house rents, people are not being kind for those health workers. I mean, we should be more kind about it. Okay, they have to work, but at least we can just help them about house rents, and about, I don't know, we can help them about money. We can just provide them food if they need any money or something. I'm saying that we should make them to live more relaxed and out of the hospital.
Yeah.
So that's what I can say.
Abdurrahman, are you going to ask a question to Zainab?
No, I really agree with her statement. I
Uh-huh.
really want to add some more thing. Like, just imagine this is a war. Okay, when a war happens to a country, what happens? We depend on the soldiers, military, commanders. Am I right? So
Yes.
that, so if they are doing good, if they are doing good, so that we will save our life. So now for example, now just think, now nurses and doctors, they are our soldiers right now. Right now they are our soldiers, they are fighting for us, and it
Yes.
is their duty to do it. Like when a person becomes a soldier, his duty is to save us. Okay, he was born to die, he was born, he is born to fight for us. Okay, so like the same way, all the doctors and nurses are soldiers, like right now they are helping us, they're saving us, and we need to appreciate them a lot. And this is what I want to say.
Thank you. You're right. Yes, Shawan.
So let's say, let's change it. Like, think you're a old people with some health issues, or even if you're not old, you can have some health issues. So we can make it optional to those who are older than like 50 age, and if they have a important health issues, then we can make them the job optional. This is my suggestion.
Okay. I didn't really get it, but I agree with Abdurrahman and Zeynep, because when you choose to be a doctor, you choose to help people. And whether it's a good situation or bad situation, you don't have choice. This is your job. I mean, if it is the case of education, I will do it. But it's now the case of health, then you are educated on this issue, so you should take the risk, I guess. But I again agree with Zeynep, because as you said, probably Shawad, as you said that probably a mother, she's a doctor and she's leaving a small kid at home and going to hospital to have someone else's kid maybe there, but she's leaving her own at home right now. So as Zainab said, we have to make their life easier. So what can we help them at this point? Maybe we can help them to take care of their kids. You know, like we have a neighbor, let's say, she's a doctor, she's leaving a small kid at home with a grandma or grandpa or someone, a babysitter or somebody. Maybe we can help them to take care of the kids during the day while the mother is not at home. Because as far as I know, in Turkey right now, it changed, of course, for the 1st of June, but before the former period, the health people, staff were working 24 hours and then going home for 2 days off, then again working for 24 hours. So they were working in different periods of time, because our government said that not all of them are needed at the moment and they should take care of themselves too. So they work half of their duty. They worked a week and the other week they stayed at home with their families. And then other staff went to work, and the ones who were working stayed at home and have a rest. So maybe we may think of making their lives easier. How about the hospitals? At the beginning, Sheva said we have enough hospitals right now, because in some countries, we can mention the name, in Italy, people didn't have chance to get cured in the hospital. They couldn't have the treatment at the hospital because there weren't any beds to make them lie down in the hospital. So it was a real big issue for them, because there were a lot of ill people to take care of. Right now, we don't have that much, but do you think our hospital facilities are enough? And my second question about these facilities is, do you think there must be special hospitals for just this virus? Because right now, I'm going to give you a chance to speak, because right now, even if you are having any trouble, like let's say I'm having a problem in my eye, or I'm having a toothache, I'm afraid to go to hospital because I'm afraid to get infected of any other person at the hospital, because I'm going to be getting treatment at the same hospital with the ill people who are having treatment at the hospital right now. So do you think the patients must be separated and the hospitals must be separated? And if you are going to a hospital just because of the virus, you should go to a special hospital for that. Yes, Sarah?
I think we shouldn't, because we have already have some beds to take under control the virus, and the virus is almost done, almost finished, and that's why we don't need it. But I'm talking about for Turkey, not Italy. I mean, Italy needs the new hospitals, of course, but I think the Turkey don't need to build some new hospitals. And you said I'm afraid of to go to hospitals for any reason, and we are afraid of going anywhere. I mean, we are afraid to go markets as well. So I think if you can protect yourself, there is nothing to worry about. My thing.
Okay, thank you. Mariam?
I think the hospitals for just coronavirus, it must be because if I go to the hospital for a different illness, but there's a guy who has coronavirus, I can have coronavirus too, and because of this, if I notice it and I go out again, and I others can have coronavirus too, and like this it spreads more, and it must hospital must be, I think.
So you're saying that that issue may start a chain of virus. Yeah, okay, thank you. Yes, Zeynep?
I agree with both Mariam and Sarah, but I think we don't have to build a new hospital. Like in Bursa, we have an hospital like it's called City Hospital, and we didn't build it now, but we had that hospital, and then we started to use it as like people would have virus. So maybe we can do this for Turkey, but in countries which can afford to build a new hospital in the short time and need that, they can build it. But for Turkey, I think we can just use the hospitals that we have for that way. But there's a point, there's doctors that are working in that hospitals, and probably it is not going to be fair for them, because in the other hospitals the doctors are not working that much, but in hospital they have to work about 24 hours. So maybe we should make changes about the doctors in for for I don't know, time to time. Maybe we can do this for that.
Different periods of time. Maybe I made my point wrongly. As you said, we don't have to build up new hospitals. You're right. What I was trying to say, as you said, right now we have many hospitals, but we can specialize one hospital just for a group of ill people, and the rest may go to other hospitals, as you said. But again, you are right. I think I agree that it may cause a problem, because working with ill people, that will be a disadvantage for other doctors. What do you think, gentlemen? Do you think hospitals should be separated? Yes, Ismail.
I don't think it should be done so, because hospitals are places where people are treated. So there should not be options on of which patient to be taken to which hospital. So it's good, it's better to divide the patients equally to all hospitals. And if there are not enough hospitals, like some countries, like where it happened in China, there was the run out of beds in hospitals. So they built a temporary a hospital in a week, I think. Yeah, in a week they built a hospital which had a capacity of more than 5,000 beds. So if there is need to build one, it should be built. So it can be divided equally into all hospitals, so that there should not be in a conjunction in one hospital. Thank you.
Okay, thank you. Yes, Joanne.
For those countries who don't have so much hospitals, like if they have lack of hospitals, they should control the spreading, and by that they can the hospitals can be availed for the patients, so that if there's lack of hospitals, then and also the virus is spreading fast, then hospitals won't be enough for them. But if the government can control the spreading, then the hospitals that they have should be enough.
Okay. Yes, Abdurrahman.
According to country which I live here, the hospitals are separated. Like some hospitals are with the full of coronavirus patients, and some hospitals aside because the people will not afraid to come to the hospital. For example, if a person have a toothache or any high fever or any other infections, if he stays at home by fearing that like if I go there, maybe I might get coronavirus from the hospital and it will be more dangerous, then the person will not go there and treat himself. So in this case, if he stays in his home or her home, it might increase and it will infect lots of things. It will be more severe if he stays at home. So here in which right now they have and the countries in the region where mostly the people are there, they have built a temporary hospital, like a small hospital, like if for a small diseases, if for a small infections, the people can visit there and treat there itself. For example, if they're pregnant or any other some infections, they can easily go to the hospital by the ambulance. When the ambulance comes, they come into separate hospital, not coronavirus patients. So I think it is a good idea. But whereas in a poor country, maybe they cannot effort like this, but they should divide the hospital into two parts and work equally, like give them treatment equally.
Okay, you mean that the people, the doctors who are working in those hospitals might work in some schedules, like working schedules, right? Because
Yeah, yeah. The doctors which are working in a coronavirus patient, they don't work to other hospitals. They work there itself. They don't change timings from here to here. They don't change their hospitals.
okay, because it's a risk also to take
Yes,
the illness to the
yes,
other hospitals. You're right. Okay.
yes, yes.
Okay, what do you think, yours and Ismail? Because I think Zeynep said it's not going to be fair if only those doctors who work in specialized virus hospitals, it's not fair for those people. It's not, they should have equal chance with the others, as I understood. Am I right, Zeynep? Okay, Şevval?
But she was the one who says that this is their work. So I'm a bit shocked about the Zeynep to say that.
Yes, Zeynep.
I said that, and I said all doctors have to work right now. But when we're looking that, we're separating the doctors and we're making like just those doctors have to work for 24 hours and the others don't have to do it. So when we're looking at the situation, it's unfair. But so all doctors have to work, not just some of them. That's what I'm trying to say.
Yes. What I'm trying to say is what Abdulrahman made a point. He said that the doctors who are working in the specialized virus hospitals shouldn't move to other hospitals because it is a risk to take the virus from one hospital to other. But on the other hand, we think, I guess, what is in our mind is other doctors who are working in normal hospitals are not taking risk as much as the ones who are working in virus hospitals. So, is it fair or is it a must to work like this? Abdurrahman?
According to the end of statement, I really want to, if all the doctors work equally, they should work in the hospital itself. They should not change the timing. But like, for example, a doctor who is working with the coronavirus patient, he needs more the other doctors, those who are treating the other sick people, like toothache or and any other thing. So I know there will be a difference in the doctors. So we need to understand and for satisfying them, we can appreciate them, and we can, of course, the government, they are increasing their salaries, of course, as well, and they're giving good they're offering more for them, for making them happier. So now if in their hospital and then if they
Can we
change here to here, be more good. Yes, please.
Can't hear you well. Can we say that those ones who are working in virus hospitals are volunteer to do this?
Yes, yes.
Okay. Okay, thank you. Zeynep, you were going to say something.
Yes, but I couldn't hear what he said right now. But before he said something like, I mean, they can carry the virus, I mean, the doctors. So I agree with that. So maybe we can do something like that. Doctors can, in those specialized hospitals, maybe doctors can work like replacement. I mean, maybe if there's a 5 doctors that are working in there, maybe we can make them 10. And then if they're working 24 hours, maybe one of them will work about 12 hours, and then the other one going to work the other 12 hours.
They will work in periods.
Yes.
Okay. What he said, just you said I couldn't hear the last words of Abdurrahman. What he said that the people who are working in virus hospitals are working in good conditions because their salaries are higher than the other doctors. And I guess in those hospitals who are working, they are taking risks, but they are volunteers.
Can I answer?
Yeah, sure.
Maybe when we're looking our countries, yes, maybe doctors are earning a lot of money, but when we're looking at undeveloped countries, we can just think for our countries. When we're looking at undeveloped countries, even doctors' living conditions are not that good. So again, we should help them.
Yes. All right. Okay. We are almost at the end of our session 2. Would you like to add anything about the health system? No. Okay. Right now it's 3:45, ladies and gentlemen. Let's meet at 4 o'clock and let's have our last session and make our reflections about each session from morning till now. What did we talk about and what are the resolutions that we can take notes and end the day, okay? See you soon in 15 minutes at 4.